Hello and welcome to A.G.Zone. In this video, we'll be discussing about the disorders of digestive system. As you may already know, our alimentary canal starts from mouth and moves through esophagus, stomach, small intestine, large intestine, and finally through rectum. Now let's move to our topic, which is disorders of digestive system. And our first disorder is the inflammation. Inflammation of intestinal tract is the most common ailment due to the bacterial or viral infection. These are the two main reasons because of which the inflammation of intestinal tract occurs. And the second is the infection. Now the most common cause of infection is the worms. The infections are also caused by the parasites of the intestine like tapeworm, roundworm, threadworm. These all kinds of worms contribute to the infection of the intestinal tract. I repeat: tapeworm, roundworm, threadworm, bookworm, pinworm, etc. Now let's move to our second type of disorder. This is jaundice. Jaundice directly affects on liver, and the identification of jaundice is very easy. Due to the accumulation of bile pigment, the skin and eyes turn yellowish in color as it affects the liver, so it also has an effect on the production of bile. Now the third disorder is very common. It is the ejection of stomach contents through mouth. This reflex action is controlled by the vomit center, which is the medulla. In this, the food which you have eaten comes through esophagus from your mouth. This is controlled by the vomit center in your brain, which is medulla. A feeling of nausea precedes vomiting. That means you feel noxious after you vomit. Next disorder is diarrhea. In diarrhea, there is an abnormal frequency of bowel movement. That means the digested food is frequently removed. With the increased liquidity in the fecal discharge, it is known as diarrhea. In diarrhea, it reduces the absorption of food. That means no water is reabsorbed or nutrients are also flushed out of the body. Next is the constipation. In constipation, the fecus is returned within the rectum as the bolus movements occur irregularly. That means the contraction and relaxation of the intestine occur irregularly. So the food is absorbed more and it remains solidified. So it causes pain in ejection. And last and foremost common, it is indigestion. In this condition, the food is not properly digested, leading to the feeling of fullness throughout the day. The cause of indigestion is inadequate enzymes secretion in the stomach, etc. Anxiety, food poisoning, overeating, or excess of spicy food also lead to the problem of indigestion. That was all about the disorders of digestion. If you like this video, consider subscribing.